reading this afternoon is taken from Psalm 3, verses 2 to 6. Psalm 3, verses 2 to 6. I will read in your hand. Hearken unto the voice of my cry and sorrow. Many there is which say of my soul, there is no help for him in God. But thou, O Lord, art a shield for me, my glory, and the lifter up of my head. I cried unto the Lord with my voice, and he heard me out of his holy hill. I laid me down and slept. I awakened, for the Lord sustained me. I will not be afraid of 10,000s of people that have set themselves against me round about. Our opening song is A Shelter in the Time of Storm, number 528. 528. Shelter in the Time of Storm. Father which art in heaven, we are indeed very grateful unto you and thankful for your goodness and your grace towards us. We thank you for bringing us safely here today, and we pray that your Holy Spirit will continue to tabernacle with us as we endeavor to learn a little more about what has been plaguing the world. We pray that you will give us strength, courage, and the awareness of being mindful of the fact that you are God, and you are Lord, and you are worthy to be praised, and that everything and anything you are able to sustain. So we pray that you will keep us strong, keep us healthy, and help us to realize that our need for you now is greater than ever before. So let us rejoice and rely upon you for the rest, all the days of our life. Give us strength this afternoon. Be with the speaker and help him so that whatever he brings out to us, we will pay heed and that it will be a blessing to us. In Jesus' precious name we pray. Amen.
Good afternoon, brethren. I am very grateful and honored to be here this afternoon to welcome everyone back to our service this afternoon. We are here for a purpose. We are here because we want to learn more. We are here because we're trying to safeguard our health. Right, brethren? Okay, I'm happy that you came, and I know your bags are filled with questions. You're bursting in the seams. You want to learn how to take care of yourself and your family and the community at large. And we're very grateful that God has given us the privilege and the opportunity to be here. And thank God we're still in the land of the healthy. I hope we are all in the land of the healthy. And we still have the opportunity to do well. So as we sit, let's learn how to do better to make sure that St. Lucia remains safe, in spite of the fact that we've heard some not too appealing news, but then at least we still have the opportunity to do something about it. So let's make sure that we listen, we ask all the questions we can. I'm very grateful that Dr. King is here with us, and he's willing and ready and able, I'm sure, to answer all the questions we may have. Let's sit, relax, and enjoy the afternoon, and we pray that God's blessings will continue to be bestowed upon us as we learn and listen and be healthy. I'd like to invite Sister Donna, she's very equal with Dr. King, and she will introduce him.
Good afternoon, brothers and sisters. It's a good privilege, and I'm extremely happy to see so many of us gathered here. I hope there are more on their way so we can all benefit. But it's my pleasure this afternoon to welcome Dr. Stephen King. Of course, he's a pathologist, and he's also the director of Laboratory Services and Consultations Limited. We call it Lab Services for short. And if you know, it means that he's also my boss. Yeah? Yes. So what I can tell you about him, he reaches from the smallest to the oldest. He interacts with everybody, and I'm sure everybody in St. Lucia knows Dr. Stephen King. Yes? So it's really an honor for me to introduce to you Dr. King, and I'm counting it a privilege that he is here today to discuss COVID-19 with us. For those of us who've been following the news, he's one of those very integral in getting the information out to the public. And for those of us who were tuned in to HTS on Wednesday night, they had a phenomenal program. A lot of information was shared. And thanking him for this, he's here today in our lobby, giving us that information firsthand. There's no TV, there's no monitor, and we can ask as many questions as we would like. So help me welcome Dr. Stephen King.
Good afternoon. Thank you for having me here to share your Sabbath with you. And I was listening, a shelter in the time of storm. Well, we're in a time of storm, and the Lord knows we need shelter. And that is our shelter. So I want to talk to you in that mode, because how is the Lord going to give us shelter in this storm? Provide us with knowledge, provide us with the comfort of one another and the comfort of the faith that the knowledge that we have, we can act to protect ourselves, our loved one, and our country. So COVID-19, coronavirus disease 2019, 31st of December last year, 31st December 2019, in the Hubei province, Wuhan city, in China. They reported cases of a new type of acute respiratory disease. That is a disease that was causing people to have fever, cough, and shortness of breath, and some were going into respiratory failure. Their lungs were failing on them, and they were dying. To date, up to now, there are over 132,000 cases of COVID-19 in the world and just under 5,000 deaths in over 118 countries. And of course, in St. Lucia on the 13th of March, that was yesterday, we reported our first case, confirmed case of COVID-19. Somebody who was visiting us from the UK, came here via Grenada, in fact. And so there's no doubt that we are going to face this storm head on. It's coming. It's probably here already. It's definitely here in an imported form. The question is it here in community spread? And let me explain the difference between that. An imported case is somebody who has come in, we've picked them up. In this case, we got this particular person quarantined, or isolated, I should say, within 4 days of her being here. Community spread, so that's an imported case. It's come in, it's not in the general community. Community spread means that it is in our community and it's spreading from person to person to person, from St. Lucian to St. Lucian in St. Lucia. Now, you would understand that an imported case is not as dangerous to us as community-to-community spread. As of yet, we are uncertain if we have the community spread, person-to-person spread. We do not know that yet. But it's quite possible. So we have to be prepared. And I'm going to talk to you about how we can be prepared. Now, I want to talk to you first, before I talk about quarantine and isolation, I want to talk to you first about your prevention of you getting infected, your personal, what you can do yourself to protect yourself from getting this virus. Before I get there, COVID-19, coronavirus disease 2019, is caused by a virus called the SARS-CoV-2 virus, SARS-CoV-2, SARS-CoV-2 virus. SARS stands for the Severe Acute Respiratory Syndrome. CoV stands for coronavirus. And why we call it 2 is because it is the second SARS virus. The first one was in 2002. Between 2002 and 2003, we had a SARS pandemic. It affected 8,000 people in the world and killed 800. In fact, 797. This one is a new SARS virus. Never seen it before. It's different from the first one in that it is more infectious. It is spreading more quickly. So as you'd appreciate, we had 8,000 people back in 2002, 2003. We already have 132,000 plus people already infected. We had 800 dead in 2002, 2003. We already have almost 5,000 dead. So this is a far more infectious virus. However, it is not as deadly because the old SARS virus used to have about 10% of people that got it died. So 8,000 people infected, 800 dead. This one has a lower fatality rate, But because it's so infectious and affecting so many more people, it's causing a lot more death. Okay? The case fatality rate in this, the amount of people, the percentage of people who die who get this virus are between 1 to 3%. Mind you, that fatality ratio can go up depending on how we as a country control the infections, this infection. What happens if people get infected with this virus? 80% will have a very mild illness, just like a cold. They will not have any serious problems, but they will be able to spread it. There are some people that we believe have the infection, have no symptoms at all, asymptomatic. They don't even know they had a virus, but they could spread it. 20% of people that we know of who get infected will have a severe illness, an illness that will put them down in one way or the other, make them feel very sick. 5% of people who get this virus will be so sick that we will call them critical. Critical, where they need to be in an intensive care unit, and half of them will have to go on ventilation, and half of those will die. About 10% of people who have this infection will end up in hospital. Now, you need to understand, hospitals have a certain amount of beds. In the country, we have a certain amount of ventilators. That's the machine we use to breathe for people. So you'd appreciate that if we have a lot of people who need to get into hospital and a lot of people that need to get on ventilation, we will not be able to cope. Therefore, our hospitals, our intensive care units will become overwhelmed. We will not have space to put people. We will not have space. We will not have ventilators to ventilate them. And then you would understand why the case fatality rate goes up and more people die when we cannot cope with the amount of cases that are coming in. An example of that in the world today is Italy. If you look online and look at what's happening in Italy, you will see that the case fatality rate, the amount of people that are dying, are almost 3.6%, getting up to 4% of people, and may go higher because their health systems are overwhelmed and they cannot manage the amount of people that are coming in. So you'd appreciate how important it is to keep that number down. And I'll come to how we need to keep that number down. Because all of us are going to have to help to make that so. This illness, we can only tackle this virus if we are all together, we all understand, and we all act as we're supposed to act. This is no more time for division, no more time to second guess and think it won't happen. This is time to understand and act. This is essentially, this is a war. This is a war. And we must be together if we are going to reduce the amount of casualties that we are going to have. Okay, so let's talk about what you must do for yourself. This disease is spread by droplets, meaning when I cough, droplets come out and they will go for a way and then they will drop onto whatever surface is there. A desk, a chair, a table, the floor, wherever. Okay? The podium, wherever. Okay? We believe, or the WHO, scientists tell us, that it goes for 3 feet and then begins to fall. Okay? So you'd appreciate, for these droplets, which have virus in them and can infect you, when these droplets get into your nose, your mouth, or your eyes, if it gets onto your face, or you inhale them, or it falls on your lips and you lick your lips and in it goes, right? You get infected. So, for casual contact, as we sitting down here, we should be 3 feet away from anybody, at least 3 feet away from anybody who's coughing. All right? That's the first thing. Now, this particular disease doesn't seem to have a lot of sneezing associated with it. it more has what we call a dry cough associated with it, okay? The other, I'll come back to that just now again, I think. Let me continue with where we're going. So, droplet protection is a key strategy. How do we protect from droplets in the air? Well, one way, if you have a cough, get yourself some ordinary surgical masks, which are very cheap, and put a mask on your face. That's if you have a cough. If you have a cough. If you don't have a cough, you don't need it. But if you have a cough, put it on. Because once you have that, you put that on, you are protecting the people around you. You're protecting your family. You're protecting your congregation. You're protecting the public. You're protecting everybody. Now, you have to be careful how you use that mask, because the mask will get contaminated, because you'll be coughing into it, so you'll get virus into that mask. So you have to be able to replace that mask on a regular basis. And how do you replace that mask? You replace that mask very carefully by making sure, first of all, your hands are well washed. And I'm going to tell you about how you wash your hands just now. Your hands must be well washed or well sanitized. You take it off your ears, and you dispose of it in a bin that is covered. Okay? That's how you're going to take off that mask. And of course, you wash your hands again, and you can put another one on. Just because you don't want to contaminate around your head and hair and these places. Okay? Why? Somebody might come and touch your head or whatever and get it on their hands. All right? Because we all in anything together. So we want to reduce where we contaminate. The next thing, if you get it on a, let's say, surface. So I cough and it's hair. I put my hand, I'll pick it up. I rub my eye, I pull my nose, or I put my hand or my finger by my mouth or in my mouth. I will take the virus from here and put it in one of these places, and it will infect me. That is why hand washing is so important. You hear that cough? Right. Hand washing is important. Hand washing is done by getting soap and water. You'll open your pipe, you'll wet your hands, you'll take your soap, you'll lather up the soap on your hands, you will rub your hands like this, you will rub your hands like that with your fingers in between. Can I use this mic here for a minute? Yeah. This one's on, right? No? Put it on? All right. So you have the lather. You rub your hands. You get it on your wrist, up your arm a bit. You do like this. You do like that. Right? You do like this to get your fingernails. Like that. You did the thumb, all right? Again, the palms. And you do that, wrist, all that, long enough, at least 20 seconds. Now, there are a number of things that are 20 seconds. The one I like that I heard today is the first verse of our national anthem, right? So that's a kind of nice one to use, right? Maybe you can do the first two verses to make sure you have enough. Then, of course, you wash off the soap. You take either your hand towels, if you have that, or if you have a regular towel, it's going to be the regular towel, right? If you have a regular towel, it's actually good for each person to have their own towel, eh? You know what I mean? But then you have your towel, and then you'll close the pipe. We like to, in the workplaces where we have hand, we like to close the pipe with the towel, right? If not, at your home, well, you can close off the pipe as best you can, probably with you'll have to use your towel, okay? The idea is, remember, you put the pipe on with your dirty hand. So you don't want to dirty your hand again by touching the thing. You with me? you could, whatever it is you want to do to decontaminate your thing, you can do it. So that is hand washing. You can also use hand sanitizer. Hand sanitizer is any fluid, substance, gel that contains at least, now they say 60, I like 70, at least 70% alcohol. Okay? The books will tell you between 60 and 70% alcohol. The problem with alcohol is that now, let me tell you, rum, which is 80 proof, is 40% alcohol. Rum, which is 151% or 160 proof, that is 75 to 80%. Right? Hand sanitizers are probably going to be sold out in the shops, so you may have to make your own hand sanitizer, which you can do with alcohol. That is alcohol and a substance to make sure you have up to 70%. Now, that you have to be careful with that. You with me? Because we must get 70%. For me, what I have been doing, I can't tell you I see it anywhere else, because it's hard for you to get 100% alcohol. Now, they would tell you to take 100% alcohol, mix it 2/3, 1/3 with aloe vera gel. That's what you see online. That's difficult. For me, what I like to do, I don't know, now I hope it's absolutely the right thing, but I'll tell you, a little bit of coconut oil, a little bit of oil with 70% alcohol works well enough, because you can use it, and your hand remains a little bit moist because the oil stays back on your hand. Because the thing is, pure alcohol makes your hand very dry. Okay? All right. So, this is what we have now. If you do, and you can take your hand sanitizer in your little bottle and you can carry it with you. So like the Reverend and I, when we shake hands, if we felt we had to hand sanitize after that, we could just easily take out our little thing and do our business. All right? The other thing about greeting, and again, so the Reverend and I shake hands. But what you can do, you don't necessarily have to shake hands to greet. And we're going to have to start understanding, because it's a reflex for us. We're going to have to start understanding. We don't have to hug. We don't have to shake hands necessarily at this time. There's the bump, but even the bump, you can think. So there's greetings, you know. There are other ways of greeting without having to touch. But you want to reduce casual touching of people, casual touching of surfaces, okay? Now, in terms of surfaces, your counters, you mentioned your wash basin. What can you do to decontaminate your surfaces? The simplest solution that we can use is bleach. Everybody has bleach. Look at the percentage of bleach on the bottle. And what we want to make is a 0.1% solution of bleach in water. That will kill the virus on any surface. Okay? Bleach is a corrosive irritant, in fact, quite a poisonous substance. You cannot drink bleach. Okay? Bleach, if you put bleach on you, it's going to irritate you. Sometimes it even irritates your nose. So look at the bleach bottle. The one that we have here, concentrated bleach, tends to be about just over 5% bleach. I believe you can get lower concentrations bleach, but check on the bleach. I'm going to give you the formula for the 1% and the 5%. If you have 5% bleach on the bottle, or you see 5% when you look at it, you know what I'm talking about, right? Okay. If you see that, what you must do, you have essentially 1 cup to 49 cups of water. 1 cup of bleach to 49 cups of water gives you a 1 in 50, so a 5% becomes a 0.1%. Okay? You making sense? If you have a 1% bleach solution, you have to take 9 cups of water and 1 cup of bleach, and then you will make a 0.1%. That's what they call a 1 in 10. All right? Does that make sense to everybody? Bleach must be made up every day. You mustn't keep the bleach there all the time, because it loses its potency when it stays exposed to air and stuff, okay? So you make it up every day. You can put it in a little spray bottle, and you can spray your whatever surfaces you want to spray. Okay? You tend to look to see where you touch, where people touch. These are the surfaces you want to clean off. Okay? Let me talk about the symptoms and what you need to do if you have symptoms. If you have the symptoms of the disease, fever, virtually everybody has fever, dry cough, muscle pain, sore throat are the main first signs we have. Some people go on to get shortness of breath. They start to breathe faster. Little children, you'll see their noses opening and they breathe in faster. That's one of the first signs of shortness of breath in a child. In an adult, you will feel it. The same thing will happen to you, but you'll also feel short of breath like you're having an asthma attack. You'll begin to feel short of breath. That is a bad sign. That means you really have to get into care. If you have any of those symptoms, what we are telling you is don't rush to the emergency room necessarily, because if you go to the emergency room or the doctor's waiting room and you don't tell anybody that you're coming in with that, you will be exposing all them people. So remember I spoke about the mask? One of the first things we do when you have the symptoms is you put on your mask, or if you don't have a mask, you go to a place and you tell them, I suffer with a cough, I want to see the doctor, so they can give you a mask. Preferably, we want you to call in to your, wherever you're going. It could be, and the government is going to have to get this sorted out properly. It could be your health center. It could be the center that they set up to receive people who have respiratory symptoms, because we are talking about creating these specialized clinics that people can go to that are dealing just with this. And that is a place you'd prefer to go to rather than going into some of the other places. And I might explain to you why that might be even more important. Okay, so you go, preferably the health center or the doctor's office or the hospital knows that you are coming, and they can be set up to know how to manage you. That is the perfect. If you have arrived, just make sure and tell the people so they can put the masks on you and put you to sit down so that they can then organize you. The other thing, of course, as you'd appreciate, just like in your home, not only masks, but your hands are important. So when you go to the clinic or the space, it's good for you to desanitize your hands or sanitize your hands and have your mask. Everybody clear on this? Okay. Why is this so important? This particular virus and this disease is a very interesting one in that older people are dying more. People, remember I told you it has a case fatality overall of 1 to 3%. If you are over 80 years old, or people over 80 years old, 15% of them, actually 14.8%, 15% of people over 80 when they get this virus are dying. 8% of people between 70 and 80 when they get this virus are dying. 4% of people between 60 and 70 when they get this virus are dying. Under the age of 10, virtually nobody is dying. Right? Between 10 and 20, about 0.3% of people are dying. So in other words, as you'd appreciate, this is a virus that is primarily killing older people. But not just them. It's also killing people that have diabetes, hypertension, heart disease, cancer. People who have chronic conditions like that, people who have asthma, people who have COPD, chronic obstructive pulmonary disease, that is smokers. It's killing all of those people more than it's killing other populations. So you would appreciate diabetes, hypertension, older people, COPD, asthma. These are people that go into clinics all the time. So when we go with our coronavirus into those waiting rooms with those people and we get them sick, we are actually, well, I wouldn't say that, but we are giving them a high chance of dying or having a very severe illness. That is why we want to separate the people that possibly have this illness and people that don't, okay? Now, the case definitions is getting quite interesting. The case definitions by the WHO of what we call a suspect case is somebody who has this acute respiratory illness that I told you about, fever and cough, etc. Plus, they've been exposed to people who have, or somebody that has the COVID-19 infection or disease, or they're coming from a place where there is community spread of COVID-19, and I explained to you what community spread was already, right? Person to person in the country. The thing about that, if you think about it, is most people coming from overseas now, from the United States, from New York City, from Florida, wherever they're coming from, most of them, London, are coming from places where COVID-19 is spreading in the community. So it means that all these people, our returning St. Lucians coming from there, tourists coming from there, are all suspect cases if they have anything like a fever, any such thing, right? The other definition is if you have an acute respiratory illness and you are sick enough to be put into hospital and we can find no other cause for your acute illness. In other words, we don't see a normal pneumonia, we don't see influenza A, and therefore, and we know we have COVID around, therefore we have to assume that you are a COVID-19 patient. How do we confirm that you're a COVID-19 patient? We have to do a lab test on you. We take a swab from your nose, the back of your nose, we push a swab down through the base through the nostril, the base of the nasal cavity to the back, and we also swab your tonsils and the back of your throat. Okay? We send that to get what we call, you've heard everybody talking about it now, RT-PCR, PCR testing. You've heard that in the news so much, everybody quarreling, why doesn't St. Lucia have this testing, right? The machine has arrived at Victoria Hospital. The training and the kits are here. The training is going on, or will be going on next week. Fingers crossed, that machine will be up and running and testing in 2 weeks' time. Yeah. Next week has to pass, and the week after that, there are going to be a couple of days when they're going to have to validate it, make sure that the results are accurate. This is not like your stereo or your radio that you can buy at Courts, plug it in, turn it on, and there's jukebox. No. Right? No. Right? You have to go through a process to get this thing up and running, okay? Because you can't give fake results. Because it's a serious thing. So that is, and it'll be really good. It'll take about 4 to 5 hours from the time they start the analyzer, when they have it set up and they put the test on and they run it, it'll take about 4 to 5 hours to give us a result. And you're going to see why that is so important in a little while. Now, there are some other tests that are coming on, what we call rapid tests, which are a different methodology, right? Not PCR, a different methodology that can give us some preliminary results. And we are hoping to have some of those kits on island too, because that will complement the gold standard test of PCR. Currently, when we want to get PCR tests, I can tell you, I should tell Donna, in fact, we have three patients with their swabs waiting to be tested in our lab, and we have to send them to Martinique or through Victoria Hospital to CAFA in Trinidad. That's where we have to go now. Martinique will give us a result usually within a day, right? We put it to the test the other day. It takes about a day to get our result. We sent a sample up there on Sunday. Monday, we had a result. Okay? It was negative, by the way. All right? So that is what we have to do now. And that's what we are doing. Now, let me talk a little bit about, in fact, before I go there again, treatment. There is no specific treatment for this particular disease. But there are very promising medications that There are very promising results with certain medications. The Tamiflu, or a variant of it, there's a new one very similar to it. The anti-HIV drug called Calitra. Some anti-malarial drugs, chloroquine. Some of these drugs are looking like they're very useful. But the most important thing is for us to give the patients proper support. Make sure if they're sick, they're in the hospital bed. We're keeping their fluids up. We're watching, we're monitoring their parameters. We're giving them oxygen. If their oxygen saturation starts to drop, we're going to ventilate them. If we cannot maintain them with ordinary oxygen going into their nose, and we need to breathe for them. That's how we have to manage patients who are sick with this disease right now. And it's going to remain like that for a while. Vaccines to prevent the illness are not available yet. They will not be available for another year to a year and a half, from what they're telling us. Why? Because although they've identified a number of promising vaccines, you have to test them to see, one, if they truly work, and secondly, what kind of side effects will that vaccine cause in people? Because you may find that you do more harm with vaccines that, depending on the effect it has on the body. So that is why we have to wait to make sure that they are safe and effective before we can start to use them. Now, a couple more things to mention to you. From the national public health point of view, there are a couple of terms I want you to understand. Quarantine. Quarantine is a term we use in public health which means people who are well, they have no symptoms, but they have been exposed, we believe, to COVID-19. Let me give you a classic example. Somebody has come from London to St. Lucia. They have no symptoms at all. They are well. But because they're coming from a place where it's active transmission, we have to quarantine them for 14 days. There are two ways to quarantine people. You can quarantine them, self-quarantine in their home, or we have to set up national quarantine facilities where people can go. If you are quarantining, self-quarantining at home, the person must be responsible. So we must know we can trust the person. We must know that the place where they're being quarantined is adequate and safe. So it is not a little place with 8 people inside of it, you know, where other people can be easily infected. And maybe I should give you another statistic. If you see you're in close proximity in a household, remember I said it's 3 feet for the droplets. However, the studies also show that if you are living in a closed space with somebody, 6 feet is actually the distance. People have become infected being 6 feet or more away from people, okay? So we have to be, so in other words, you can see that if you're in constant contact with people with this virus, the distance that you have to be away from them is further. And of course, you have to use more protective gear if you are going to be nursing or being with people who have this virus. Healthcare workers and people in houses who are looking after people who have the infection, okay? But let me get back to the quarantine for a minute. So a well person, self-quarantine in their house, or quarantine in a government or national facility. Now, so government is going to have to figure out where they're going to find enough places with enough space to quarantine people. One of the other things, and you'll understand this one very easily, since all these countries where our tourists are coming from are active areas of transmission, every tourist who comes here should be quarantined. Most of them are coming for 2 weeks. So that is why it is wise for the government, and I suspect they will do so shortly, it's wise for the government to say no more tourists. Because what can we do? mind you, our locals returning, we have to let them in. Now, these people we can quarantine because they're ours. And they come into their home. We can't leave them out there without their money up in London struggling, right? So we bring them in. They can either be at their home if they're responsible or they go into the government facility. So the government is going to have to find facilities that have enough space for that. Mind you, think about it. This is my view. If the tourists are not here, the hotels are empty. So as far as I am concerned, hotels could be used as quarantine facilities. We have bedrooms, bathrooms, beautifully set up. Right? Why not? We have to make an arrangement with the hotels. It works for the hotels. Let me explain why. If I own a hotel, which I don't, but if I owned a hotel and I have no tourists and the government came to me and the government told me, let me lease your hotel, no tourists coming anyway, let me lease your hotel from you for the next 2 months. Why not? We can have a negotiation and you can have it at a decent rate so that I can actually continue to pay my employees. So my people who have now have no work because there's nobody there, they will continue to get their salary at their home. No? So why not? So that's one thing that I think if we should put forward as a recommendation. Okay? Now, that's quarantine. So let me talk now about a thing called isolation. Isolation is a term we use when you are sick. People who are sick need to be isolated now. Now we have two kinds of sick people. We have sick people who are walking around, coughing and etc. And we have sick people who are flat down and have to be hospitalized. So we have two kinds of sick people. If you are walking around, able to look after yourself, you don't have to be in hospital. Now, so we need facilities where we can put people like that. Okay? Again, very similar to the quarantine, except the quarantine are well and these are sick. So you don't want to mix them. You would like to have an isolation facility or wing and a quarantine facility or wing. And don't mix them. The isolated people who are sick are going to be tested and a decision will be made whether they have the SARS-CoV-2, that is they have COVID-19 or don't. If they don't have it, then we can let them go. If they have it, then we know we'll have to keep them sequestered there. Now you'd appreciate, when we have our own PCR in the next couple of weeks, which is in fact, I mean it's a little late, but it's better late than never, and at least it's coming in a reasonable time for us in where we are in the epidemic, we think. But within 4 hours, we've taken the swab, let us say within 8 hours, because you've got to transport it, they've got to work on it. So let's say within 8 hours. So within the day, before night falls, or before the next morning, we can have a result and let you know, go home or stay here. All right? Clearly, we're going to have medical people at both the quarantine and those isolation facilities. In the quarantine facilities, they're going to be monitoring to see if the people get sick, because if they get sick, you move them into isolation, you test them, move them into isolation. The next thing, what we have to do in our hospitals. Now we are lucky in St. Lucia. You know, good word, we are blessed. You know, the Most High, the Lord on high has given us certain physical opportunities. Take this for example. We have the OKEU empty. We have 100 or so beds up there empty. right? It is easy enough to establish the OKU right now as the coronavirus center isolating hospital. So people who are sick can be up there. So as you'd appreciate, other illnesses are still going to happen. So heart disease, diabetes, hypertension, strokes, amputations, appendicitis, ectopic pregnancies, pregnancy itself, delivery, all these things are going to be going on. We can do all of that at the existing VH while we're managing the respiratory illness COVID people over at OKEU. All right? So we don't, in the hospital, create cross-contamination. All right? So that's important. The last thing I think I want to talk to us about is our emotional and our mental strength in coping. Because let us understand we are human beings coping with this storm. So, we have knowledge. We have opportunities. There are things that we can do to take charge of this responsibility. But it's creating stress. Even as I speak now, there is stress. We need to support each other. We need to support the healthcare workers. We need to make sure that our families, our children, all are in a healthy state of mind. The other thing, as I speak of the children, so the last couple of things maybe to mention to you. When I speak of the children, I think Easter break is coming up next week. Bring that forward to Monday. I don't think any child should go back to school on Monday. So I want you to think about that, okay? More than likely, I don't know, but quite likely they will close the schools anyway. Quite likely they will close the schools, all right? But even as we have our children in community, remember, we also have to protect them there and stuff. The other thing we know we need to do is stop the mass events and mass gatherings. Already, grocery, Friday night has gone. Fish fries have gone. We must stop all of that. We call it social distancing, where what we're doing now is people stay away from one another. Try and stay as much as possible with yourself, you and your loved ones alone. We are still going to work, that is true, because work has not stopped. But even as we go to work, in our workplaces, we must make sure that in our workplaces, the strategies, the procedures, everything is in place to protect workers from one another and from people coming in. If you have a cough and a cold, you don't go to work. If you're a boss and one of your employees has a cough and a cold, you send them away. You get care for them, I agree, but then you send them off from work. Okay? And when you take in your sick leave, isolate yourself. Self-isolation, self-quarantine. All right? Or, as I mentioned, you fall into that isolation category where you end up in the government isolation facility. So a lot depends on when you get your care, the care provider is going to make a decision what happens to you. Because they may look at you and realize this is not COVID-19. Not a suspect, or they may say it might be, in which case they would move you into that system. You all are with me, right? All right. Let me see, what else? I think I've covered most bases. I think what I've missed, I hope in your questions I'll be able to answer. So let me open up to your questions. I've put a lot out there for you. Ask me your questions and let's see what I can answer and how we can get things going. Yes, sir.
No, Dr. King, it's okay. We have a mic there. Okay. Okay, before the question, even while we have questions from the congregation, we have some listeners online and they've already posted some questions. So between questions, live questions, I'll be reading out the questions here also. All right?
Yes.
Hi, good afternoon to all. Great presentation. I have one question. In your presentation, you said that there are people who has coronavirus, but they don't show any signs or any symptoms of coronavirus in the system. How is it possible for those individuals
For them to spread it? Yes. What the question was, people who have no symptoms, they have no cough, how are they spreading the virus? Well, remember, their saliva has the virus. Now, when I talk, there are droplets coming out of my mouth. Okay? So droplets don't only come out when I cough, they also come out when I talk. They fall onto the surface. You touch it, and you get it when you put it in here. So, even if you don't have the symptoms, you can still spread. Plus, you will get it on your hands, the asymptomatic person, right? Because you will touch your face, you will touch your mouth, you will get it. You'll be surprised how many times we touch our face and our mouths and so on. We do it a lot. Something passed by you, it itches a bit or whatever. So, you know, something irritates you, you pass your hand by your mouth. And I touch you. You shake my hand. Or I put my hand here and then you put your hand. You with me? So it spreads via surfaces. You use my phone. Doc, let me borrow your phone to make a call there. Right? I have not decontaminated my phone. Right? I pick up something and then I put it down and you pick it up. The mic, the telephone. You okay? Your money. So there are lots of ways in which it can pass from person to person, even when you are asymptomatic. Okay? Now, how do we pick up asymptomatic people? I thought you would follow up with that one, but how we do it is a thing called contact tracing. Okay, in public health as well, we have a thing called containment and mitigation. Containment is constricting the virus from spreading, right? Closing the borders, not allowing people to come in. That's one form of containment, stopping from without, coming within. Another form of containment is what we call contact tracing. So that lady in red is sick. She has COVID. You see that fella in green, that little girl there in the white and gray, and that lady there in the blue, all contacts. Contact tracing makes me know their names, they're fine, but I know that they are contacts of that person. So what do I do with contacts? I quarantine them. Because they are contact of somebody who has the infection. Now they may be asymptomatic. But I will keep them there for the 14 days because also after 14 days, even if you had it, it will pass. Okay? Because the length of the illness also seems to be about 14 days. Although some people say people can shed virus up to 37 days. But the literature is not clear to me as to whether they're still infectious all the way up. So that's an interesting point. And no system is perfect, unfortunately. But these are the guidelines we're going to be using. So contact tracing and quarantining is also part of disease containment. That is very effective in the very early stages of this illness and this epidemic, when there are not so many people affected. So we have 6 people. We have 100 contacts. That's easier to manage than when we have 5,000 people and 20,000 contacts, right? So that type of containment works early early. Now, the next thing we must do is a thing called mitigation. And that is what we call, that's when I mentioned about the social distancing, which is the distance in the business places, the distance in the congregations, the stopping the mass gatherings, all that kind of stuff. I can tell you my professional organization in Canada sent out a notice yesterday that they ban all person-to-person meetings. Every meeting from now on will be by telemedicine or telecommunications, Zoom, Skype, and those ways. So you sit in your place on your phone, and that raises an interesting thing that the congregation and the church may want to think about and discuss with the elders. How long will you continue to have Sabbath with everybody? When will you decide to go to Zoom or Skype Sabbath? Where you could, well, if you handle it well, you might know you could have a whole global Sabbath where you could be in congregation with people in the United States everywhere. So it actually could be quite a phenomenal strategy. But that is something that I think people will have to think about. You know? Interesting. Yes, that was, another question? Yes.
Good afternoon. Can your body, after you have been diagnosed with the disease, can your body be immune to it, like if you get it a second time or something?
Interesting, because the answer that I'd have to give is yes. Because hence the reason why people think vaccines work and herd immunity works. So the public health people are saying that, you know, we get infected with the corona and we'll develop immunity and we'll be okay. But there are some other people who are saying it's very early, too early to tell. How rapidly is this virus mutating? In other words, how rapidly is it changing? If it's changing a lot and it's becoming, so you're getting SARS-CoV-2.1, SARS-CoV-2.2, SARS-CoV-2.3, etc., you might find, like it is in dengue, for instance, that a 2.2 you might be immune to 2.1 but not immune to the 2.2. That is the kind of thing that we don't know yet. Hopefully it's not so. Hopefully we're going to, if we get infected, we become immune. Okay? But we're not sure of that yet. But I think my best answer to you is I think yes, you do get immunity and you don't get it again. Mm-hmm. Yes, sir.
Good afternoon. Good afternoon. Doctor, in your presentation, you said that if somebody they realize they have a cough, wear your mask. Knowing that we are living in a wicked society, you know, some people, I mean, they may not know exactly if they have the virus, but some people, you know, I remember when they had the AIDS epidemic, I read about people who goes around and getting as many people infected as they possibly could. Yeah. You know, I don't see how that can work unless they have some rules, some legislation in place that if anybody, because, I mean, once you start coughing, you know, it is a symptoms of the virus, you know, unless they put something in place that if somebody realizes they have a flu, you know, and they're going to infect other people, you know, that they can be penalized.
I hear you. Let me answer you. It's a good question. I have to answer it in a number of ways. As you spoke, you reminded me that at this current time, I don't know if I said it in the presentation, but we also have flu going around right now. So not everybody that is coughing and has the flu-like symptoms is COVID now. So, and in Martinique, it was creating havoc last week because they had their first 3 cases, I think, and their clinics were overloaded because they also have the same flu. You know, what Martinique have we have? Because Martinique and St. Lucia is the same thing, right? Anyway, so that's one. You mentioned about rules, regulations, and controls. Now, there are 2 levels of control. But let's start with the state first, law. What I think would be a wise thing to happen is for the government to declare a state of emergency, that this is an emergency, that brings in more power to act legally by the chief medical officer and other people in charge of other authorities in charge of the epidemic, okay, and the response. So they can use the police to pick up people who are showing symptoms and bring them in to the isolation facilities, okay? Because I think that is what you are talking about. If they do that, and I think they should also establish command centers. A national command center with a national incident commander who is a knowledgeable person on this epidemic and the rules and regulations of what needs to be done. They should have similar incident command centers under that national in every single region, health region, so that what we have is an army which is under control, under direction, following one set of rules and responses. You see where I'm coming from? So when the incident commander says, Grozile town lockdown, what happens is Grozile town gets locked down because everybody who's responsible for Grozile can move, act, including police, health people, anything. Or if you say, go to Marianne Street and pick up Donna Providence, right? They know to go pick up Donna Providence because we are operating on intelligence. Now, where does intelligence come from? Information. Where does that come from? And that's where we all have to play a role. Information can come like how Taiwan and Singapore did it, electronically and remotely. What they did is they merged the databases from cell phone data, health data, travel data, all databases into one. So the command center, when they pulled up your name, they could see where you have been, where you are, and on the GPS, right where you are. They can know which house you are in with that mobile phone, right? So that was one way. Now we don't have all that technology. We have some of that technology, but not all of it right now. So let's say we can't do that. But you know what we do have? We have a powerful communication system, our local communication. You see somebody that have a problem, you call. We're setting up the communication line. So for instance, 311, when it does get operational, because it's not operational now, if you saw your neighbor and you suspect your neighbor has a flu, you can call 311 and you can say, I am Mr. Edward and I have a neighbor so-and-so, I am living in, and Gasa, there are 2 people in that house that have fever. So the rapid response team can be deployed from the nearest command center to come to you, come to that house and check those people out, make sure that you're telling the truth, make sure that they truly have a problem, and if they do, doing the necessary action. You with me? So that is why, remember I said at the very beginning, in this epidemic, we all have a role to play. 1, to protect ourselves, and 2, to protect our fellow man. And indeed, getting those people who are sick next to you into care is protecting them, you, and everybody else in the community. Right? So this is what I think this is what the messaging that we should be putting out. I don't think you should take the action yourself. I think you should be able to speak to the authorities who can then take the appropriate action. Yes, ma'am. You had a question, ma'am. The lady in red had a question. So, the 2 of you, don't sit down yet. You have a question to the 2 of you.
Just a quick question. Can you clarify for us the difference between a pandemic and an epidemic? Thank you.
Of course. A pandemic is simply a global epidemic. Every country in the world either has active transmission or is guaranteed to have active transmission. So when you say pandemic, that means all of us have to move from watching to doing. In an epidemic, if there's an epidemic in China, as we had in January, it was an epidemic. St. Lucia had no risk, or minimal risk, right? So we looked on and we watched it and we thought about it, we talked about it, but we didn't have to do anything much. At least so we thought. But when it becomes a pandemic, we no longer have that luxury. So as of Wednesday, when they call this thing a pandemic, our authorities must act. There's no longer any room to say, that mightn't come by us. I think we can sit still, we could wait. So epidemic is a localized infection that is spreading in a population. Pandemic is the global spread of an infection. Yeah? That's a big difference. My lady, you had a question, my lady?
We want to take a few online questions and clarifications. Okay. The first one speaks about SARS virus. The statement is not a SARS virus. There are different coronavirus. The first one was MERS and the second one was SARS. So I guess just to clarify that this one, what SARS is, what SARS means, and what this one is.
Okay, let me explain. There are actually 7 coronaviruses that cause human disease. This one is the 7th. This SARS COVID-2 is the 7th coronavirus. The others, there are 2 that cause the basic common cold, and there are 2 that cause a flu-like illness. There's the original SARS virus, which is called just the SARS virus. That's the one from 2002, 2003, which caused a severe acute respiratory syndrome. That's what the SARS stands for. And then somewhere around, I think it's 2010 or 12, somewhere around there, the MERS virus came up, which is the Middle Eastern Respiratory Syndrome virus. So that was the last coronavirus that we knew of until this new one in December, which is called the SARS COVID-2. It has actually an 86% nucleotide homology, or in other words, it's 86% the same as the original SARS. Where this virus, we believe this virus started, is from the bat population in China. The bats, there's a certain set of bats that have a SARS virus in them. And this particular virus seems to have come from there because it has a I think it's almost an 89, 92% similarity to the bat viruses. What we believe happened is it got into usually what happens, in fact, it goes from the bat population into a smaller mammal, a smaller animal, and then gets into humans. And we believe that, we don't know, but we believe that's how it started. So the SARS-CoV-2, it's a different virus, but it's very similar to the SARS virus.
Okay, and just a two-part question. What is the hospitality industry doing to protect their staff? And there's another part that asks about, especially the frontline staff, and I guess we can ask the same question for the medical team. What are they doing to protect their frontline staff?
Okay, I can't speak for the hospitality industry because I do not have any information as to what they are actively doing, right? I can tell you what they should be doing and what businesses should be doing. So your frontline staff, these are your reception staff in particular. These are the people that the public interfaces with first. For some people, it might be the security guards, because some people have to come through a security guard first before they get to reception. So in some businesses, the security guard is the first person. In some other businesses, the receptionist is the first person. We have to train security guards and receptionists about how this virus is spread and what they must do. What we have been doing, take for instance our business. I'll talk about Donna and I. We have a business. This is what we are recommending in our business. First of all, you put up a sign at the front. It's called Declare Your Cough. If you have a cough, please tell us, and please use a mask, and please sanitize your hands. As you step in, you must have the hand sanitizer right there for them, or a sink that they can wash their hands, right? Your receptionist should have the surgical masks right there, and they should take it and give it to them. Why should the receptionist take it and give it? If you allow the person who possibly has an infection to put their hand in the box with the mask, they will take a mask, but they might contaminate what's there. Okay? So then they put the mask on, their hands are clean, they put the mask on, then you have your decision. Do you allow the person to sit and be attended to in that business? So whatever that business may be. Or do you tell them, wait outside and we will do your business and come and bring it to you? I mean, these are all options you can use. And each business has to figure out how they do it. For us, what we say, where we can, we will put people, as soon as you come in, we hand wash or hand sanitize, mask, put you outside, and we will look after you right there. Our workers, because you are a potentially infected person, we will have our workers who are tending to you, getting close to you, will have to have their mask, will have to have their gloves, will have to have their coat or their gown. That's what we feel we'll have to do. Whether you have to add the face, there's a face shield you can use as well to protect your eyes and your face. You may have to do that, especially when in our business, when we're dealing with little children that might be screaming, shouting, and because they're frightened. Not their fault, they're frightened, they may spray. So you may want to have a face shield. So every business has to look at what type of people are coming there, what they're coming there for, and how can you minimize the risk that they spread that virus to your staff or in your workplace. The other thing you'll have to do, remember I mentioned about the 0.1% bleach. I would recommend that all businesses have the 0.1% bleach that they can spray down the area where the people have touched. And I don't want people to be offended by this. This is not offensive. This is just pure prevention. The other thing is your receptionists. They should have their hand sanitizer available so that after they've dealt with every client, they've handled money, whatever, they sanitize their hands before they touch anywhere else. They have to make sure that their keyboards, if they're using keyboards, their phone, if they're using their phone, is cleaned as well. Because you can appreciate, here I am handling the money, phone rings, I pick up the phone, right? So people have to be aware of what they're doing. Now, for us, like I told you, hand sanitizers may disappear off the shelf. So you may have to make your own. I haven't looked at it, but remember, if you're going to use something like the strong rum as the alcohol base, make sure it is the 151 or the 160 proof rum that you use that has the 70% or so alcohol. If you cannot get rubbing alcohol or ethyl alcohol, okay? But businesses have to think all the way through this thing. Gloves and people wearing masks and gloves. Let me mention this for a minute. Sorry, Chief. I know I'm sorry. Masks for well people. Most public health people are telling you that's not necessary, and in fact might be a little bit more dangerous. Because when you have a mask on your face, it tends to irritate you a bit, so you tend to be touching your face a lot more than you would otherwise. So when your hand has anything, it's going to get onto your face. That's dangerous. Gloves. Gloves often give you a false sense of security. I have on my gloves, so I know I don't have a problem. But what you don't realize, your gloves can get contaminated. And then because you haven't changed your gloves, you are now contaminating everything around you. Now when you take off your gloves, you pick up the thing you've contaminated. Or you get so comfortable with the glove, you actually put the glove by your eye, because your eye itches you put the glove by your eye. So gloves can be dangerous too. It is probably better to tell you, sanitize your hands. Okay? That is what the public health people are telling us, and I think I have to agree with them. So that's what we have to do. The other thing, monitor your people. If your people get sick, get them into care. Give them the leave. Don't not pay them when they're on leave, because that's a big thing in the United States, for instance. Because if people feel they're not going to get paid, they will deny that they're sick, right? When they are sick, And that will put everybody at risk. So we don't want that to happen. Just like we have to trust our people. And we don't allow people to scam businesses either and say that they're sick when they're not sick. So things like all those kinds of things we have to be cognizant. Plus, of course, we do have the NIC. So your doctor give you a sick leave, your pay, at least a business can be reimbursed or you can be reimbursed. Yes. Yes, Chief.
Good afternoon. There is something I want to ask. If you have the coronavirus or something and you sneeze or you cough, how long does the droplet stay before it dies? Let's say I sneeze
on the surface.
On the surface.
Wow, that's a difficult question. My, oh my. Donna will tell you we must have spent about half an hour on that. We don't know. That's the honest answer. We don't know. When you go online, you'll see people say coronavirus has lasted up to 9 days on surfaces. But they're not talking about this one. They're talking about coronaviruses in general. Then you read somewhere else where it'll tell you 24 to 72 hours. My Martinican colleagues that briefed us and did a presentation to us tell me 3 to 4 hours. Honestly, I don't know. But what I do know is that you should decontaminate your surfaces. If anybody around is coughing, decontaminate that surface. Hand hygiene. Sanitize or wash your hands. Right? That's what I know. So I would not wait 4 hours, 2 hours or 3 hours. I would, you can't. So I would clean it off right away. That's my view. I mean, it begs the question, and Reverend, you have a, like all of us, you have a tough job. Look at your pews here today. Were any of us coughing here today? We don't know. Will some of us be coughing in a month's time? What will happen with the benches? So we all have a lot of thinking to do. We mustn't go overboard because we can go crazy. As Donna and I can tell you, we feel a little crazy at times thinking about all these things. So you have to be sensible, practical, but as safe as possible. Yeah? I don't know if I answered your question, Chief.
No, the reason I asked that thing is because supposing somebody have it, and the person left, and I come a few minutes after you come and see the very same place. Yes, because that's why I asked.
Exactly, I hear you. And one of the things I must tell you, my brother, regular hand washing is the key. So even if you don't even know, from time to time during the day, wash up your hands. Wash up those hands. Yeah.
Good afternoon, and thank you for coming. My question is based on treatment. Thus far, this virus has a very high survival rate. Only 1 to 3% of the people contacting it seem to die. What exactly do they do to treat the symptoms? Because there's no vaccine, so how do they care for them when they're confirmed?
Now, it depends how severe your illness is. If you have a mild illness with minimal symptoms, you probably will not have any treatment at all. The treatment will be just to isolate you, keep you away from others. If you have symptoms which are quite severe, like of bad flu, but not to be hospitalized, then obviously you're going to have to use your painkillers, because symptomatic treatment, in other words, okay? Whether we start you on some of those meds I mentioned will be an individual, practitioner, and patient decision. Remember I mentioned that chloroquine, neuraminidase inhibitors like Tamiflu and remdesivir and Kaletra are all drugs that seem to have some effect. When do you start them is a good question. Some doctors don't use them at all. Some would say you're a high-risk person, maybe I should start you. Some would say only when you get a severe illness and you're in hospital that I should start you, because these can be quite serious drugs. The Tamiflu and them are not that serious. The other thing that doctors are saying, and there's a debate, there's a secondary bacterial infection that many of us, because what happens, the virus, when it gets into your system, it actually affects some of the cells in the lining of your lungs and the lining of your airways. it makes your lungs very susceptible to secondary bacterial infections, which can worsen your course and also put you into sepsis, that is systemic blood infection. And so some of the protocols are saying we should start antibiotics early as well. Almost as if you have a severe illness and with some shortness of breath, start you on the antibiotics to protect you or treat any bacterial infection. So these are all the things that are available to us, the strategies that are available to us. We're in the process right now. There are a couple of doctors right now that we are working on our protocols that we are going to use with our patients. We haven't got it sorted out yet, so I'm hoping that within the week, our doctors can be very clear. Now remember I mentioned the command center to you. If our government has a state of emergency in a command center and it mobilizes and puts the practitioners who are competent in charge of this, they will also be developing the best protocols, procedures, and guiding everybody as to what should be done. And I think that's very important. I think national protocols should be put out. National protocols on everything we've mentioned here: quarantine, isolation, treatment, hospitalization, criteria, when to use this, when to do that. What very, very clear, precise guidelines is what, or protocols is what is needed now. Solutions I know are fed up of hearing about protocol. I heard a television, or I heard about a television show when you say protocol, everybody protocol again. What we are talking about though is the details, nice, simple, clear details, what exactly to do when you have a particular situation. And I have not seen clear protocols yet. This has to be produced soon, within days I'm talking about. Yeah? I do know one doctor in particular, Dr. Benjamin, I know, is working on protocols right now. I left him a couple hours ago and he was there working on them.
Good afternoon, Doctor. I heard in your presentation, you said some of the things we have to do, and if we have to do to protect ourselves, to secure ourselves. But the symptoms of that coronavirus is so close to that of the flu. As far as I have listened to and the research I have done, the only main difference is the shortness of breath.
Absolutely right.
As people who are traveling on public buses, how can you differentiate if somebody coughs or sneezes on a bus that it is the coronavirus or the common flu? The other question I want to ask is, we heard that we know there is a shortage of everything in St. Lucia. Okay? If we cannot get hand sanitizers, we are given recipes to make hand sanitizers, but we do not get the ingredients or whatever it is we need to make these hand sanitizers, to be able to get our place clean and to be able to do all of these things. For example, you said about masks. I don't know where to, I've never gone to a store anywhere and ready to see masks available, because if you say, okay, you have a cough, you have to self-quarantine or self-isolate. How do you protect the other members of your family if none of these are available?
I fully agree with you. And that is why we need, as a country, to be very clear on our protocols and what we're going to do. So, for instance, for me, if you've come to the attention of the authorities and you're going to be self-isolated, not quarantined, because quarantine is, but self-isolated, I think, this is my view, the masks should be provided to you. We should have a national stockpile of ordinary surgical masks that we can make them available to everybody who needs them. Not everybody, so that's why the well people know, but the sick people, yes. So I think that is very important. Now I think you mentioned another one, which is how do you differentiate a COVID-19 from a non-COVID-19 cough and cold? You can't. On the bus, you can't. Therefore, everybody with a cough has to have a mask and has to be considered to be COVID-19 until proven otherwise. I also like what you said. I'll just add one more thing to it. The big difference between COVID-19 and the regular flu is shortness of breath. That is true, but you'd appreciate that Many of the COVID-19 patients, most of them in fact, do not have shortness of breath. So therefore, your question is more valid. So everybody coughing must have the mask. The other way to differentiate, the other way is the test. When the test is done, right? And that will only happen when you have got to the attention of the authorities and you are in the care of the medical team. So unfortunately, that's what we have to do. I can't see any other way.
Okay, so we have quite a few questions coming in online. A statement, Government of St. Lucia, Minister of Health, listen to the health professionals, and I think we just touched on that. There's a question on whether, well, before the question, a statement, why don't we recommission the old Golden Hope? A question on whether iodine is good enough to use as a sanitizer, I guess the question is. And then let me just put in one more. Oh, there was a question on asthma. There was a question on asthma. How easy it is for those persons to suffer complications from COVID.
All right, good questions. The old Golden Hope, I don't know how many of you have passed by the old Golden Hope recently, but I think Donna and I pass there every day. The old Golden Hope is effectively derelict. You can't do anything there. You'd have to invest in fixing it. So I don't think we can do that. I do think that we do have the OKEU building, and we do have certain hotels that are available. Because we actually have hotels that are empty now as well. So that haven't had tourists for the tourist season at all, because for various financial reasons, they're not open. So I think we need to look at other buildings apart from the derelict buildings. I don't think we have time to fix derelict buildings. But I do think we have enough other buildings to use. The other question, I think, was about asthma. Yes, people with asthma, as you'd appreciate, are at a greater risk of having a severe illness if they get corona, because their airway is reactive. It is more fragile than the rest of us. So, and it classifies as a chronic lung condition. So, from my understanding, people with asthma will do worse if they get infected with corona. It doesn't mean that everybody with asthma will do badly. I'm just saying you'll do worse than somebody who does not have asthma. So, asthmatics should do their best to stay away, and we should do our best to protect people with asthma, as we should do our best to protect all vulnerable populations that I think I mentioned during the presentation.
And by extension, as it relates to the asthma, would your inhalers or anything do anything for an asthma patient if they were to suffer from this?
Well, asthma patients must use their inhalers, and they have to continue using them regardless of corona, right? What will happen, of course, is that their inhalers will become contaminated, but that's their inhalers, and nobody else should be interfering with them. But they can use alcohol and desanitize them from time to time if they want. But they have to use their inhalers as normal. Okay?
Good afternoon, doctor.
Good afternoon.
I work with children. I'm a teacher by profession. And you keep saying bleach. But at the school, we don't use bleach. We only give them disinfectant in the classroom. So what do we do in this case? Because we have children. Many of our children are sick with the flu these days. So we have to be cleaning every half hour, every hour, as quickly as possible to prevent the spread of the flu. The parents sometimes don't have places to keep them, so they send them to school. But we don't have access to bleach in the classroom. So what do we do in that case?
What disinfectant are you using?
Oh, it's what the ministry sent. I think it's the chemical.
Chemical is a bleacher.
No, the chemical brand of disinfectant. They send the green, the orange, the red.
Oh, you mean
the disinfectant, yeah, that's what they send.
That's interesting, because to me, that's more expensive. Why? Well, But we have to look at the ingredients. What are the ingredients of that? Sorry. What are the ingredients on? It doesn't contain bleach. It would be nice to know what that disinfectant is. Okay. Chances are it works, but I need to know what is in that particular disinfectant before I could answer and tell you whether it works or not. But you actually reminded me, somebody asked about iodine. From my reading, I have not seen that iodine works. So I would not recommend using iodine as a corona disinfectant. Hydrogen peroxide, 0.5% hydrogen peroxide works. Some people are mixing hydrogen peroxide and vinegar. Sorry, ma'am, ma'am, I don't know if I've answered your question, so hold on there. Oh, thank you. Right. People are mixing, I think, hydrogen peroxide and vinegar. You don't have to do that. You only have to use 0.5% hydrogen peroxide. That works. All right? I don't think the vinegar adds anything to the mix. I did have some people say, which I don't understand at all, that hydrogen peroxide and vinegar can be toxic. I don't know if that's true or not. But just use hydrogen peroxide by itself if you have to. But bleach is simple, easy to use. The problem is it can be a bit corrosive. So that is why, for me, the two top ones for me is bleach and alcohol. Because alcohol, where bleach doesn't work, I believe alcohol should work. And of course, soap and water. Wash down. Soap and water will always be a good thing to use. Okay?
Some of them we would have already touched already. But there's a question concerning drinking hot fluids or strong rum to help fight the coronavirus. And there's another, I guess it's a statement, I guess it happened in the panic buying. The person wants to know, what does toilet paper, because I know all of the toilet paper is gone off the shelf. What does toilet paper have to do with helping the coronavirus?
Okay. What was the first one again? It was
about the hot liquid.
Oh, hot fluids or strong rum drinking. No. In fact, that'll hurt. Because you cannot drink enough strong rum to get to 70% alcohol or in your body. Because 70% alcohol in your body will kill you. Right? So that just can't work. And apart from which, alcohol damages your immune system. Now, maybe I should tell you a little bit about that. This coronavirus, the people who do badly are people that have damaged immune systems. That's why chronic disease, older people. These are people whose immune systems are not so good. And what we have found is that the virus kills in really three ways. One, it infects the lining of the lung, damages a type of cell in the lung called the type 2 pneumocyte, which is the cell that produces a liquid that keeps your lungs pliable and able to open and take in air properly. So what happens to people is their lungs get stiff and full of fluid in the airways, and you cannot get oxygen into the body. We call that acute respiratory distress syndrome, and that is how many people die. The other way that they thank you, ma'am. The next thing that happens is you get an immune system dysfunction, which affects the T cells in your body, and you get what we call a cytokine storm, which happens at about between 8 days and 10 days of the symptomatic portion of the coronavirus infection. And what happens then is your cells, your inflammatory cells, produce a whole lot of chemicals which affect all the organs. So it causes you to not only to have respiratory failure, you have renal failure, you have cardiac failure, and people die there. So that's the second way they go. The third way people die is they have the bacterial infection, which goes systemic and causes sepsis, and that's how they die as well. So I said all that to say defective immune systems are associated with all of those extreme damage that happen to the body. Rum, alcohol, also damages your immune system, and therefore, in my view, is going to make you more prone to having a severe course with the coronavirus. So don't use alcohol.
Okay, and a question pretty similar. It speaks about heat treatment to the back of your nostril, like I guess inhaling warm vapor or something like that. Would it help?
No, the only way it does help, and you know, we have a way some of us, when you have a stuffy nose, and so this you can do, but I mean, it's not going to do any damage really. You know how we put either Vicks or something in a pan, we boil it, and we steam, and we put our heads over, and we inhale the steam. That's okay. It's not going to kill the virus, but all it will do is it will clear your airways, right? It will reduce the stuffiness. But it's not going to kill the virus. So you can't kill the virus like that. But you might be able to help your symptoms. But don't do things steaming. As you know, you do it where you're comfortable, it doesn't damage you. But things hot in the back of your nose, depending on how hot you put them, can actually damage your nose. So whatever you do, don't damage yourself by using things that are too hot.
Okay, and the disinfectant has sodium chloride as one of the ingredients, but it does not have what percentage?
When you say sodium chloride, sodium hypochlorite?
No, it said sodium chloride.
Which is salt. But it must have something else. It must have hypochlorite or something.
Right, so it
we would need to know. For us, we work in a high-risk area in laboratories. I tell you, we use ordinary bleach that you buy in the supermarket. And that, I think, is what works. I think it's cheaper. I don't necessarily believe that the fancy things are the best things. You spend your money, but do you get what you truly need? I don't know. So maybe the ministry can have a look at that. Huh? What's that? You have bleach available. There you go. So now you know where to go.
Okay. So we have a question on whether you can get coronavirus through a cut, I guess on an open wound. And there's a question about drinking water. How does drinking water help with fighting the coronavirus?
Okay. You cannot get it through a cut, as far as I'm aware. It goes, how this virus gets into your body. The coronavirus it's called a corona because it looks, when you cut it, it looks like a crown. It's got these proteins on its surface. We call them spike proteins or S proteins. Those spike proteins bind on receptors that are in certain epithelial cells that line your mouth, your nose, your airway. Okay? So what happens is that the virus binds to these receptors and gets into your cells and then starts to replicate. Because how a virus works, a virus has to get into your cell and take over your cellular machinery for it to start to multiply itself. Okay? A cut does not have those epithelial cells, so the virus cannot attach onto anything, even if it gets into a cut. Because it is the lining cells of your airway, your mouth, and your airways, that your nose, mouth, and airways, that it attaches to. All right? The receptor it attaches to is actually ACE2 receptor, angiotensin converting enzyme 2 receptor. So that's a long way to tell you no, but explaining for you why the cut doesn't work. What is the second thing about the second? Oh, water. I'm a big advocate for water. Keep yourself well hydrated. That helps your immune system. It definitely helps you. So, yes, drink water. I have no problems with that. I don't say it's going to treat corona, but it definitely it's symptomatic support, and it keeps your body healthier, and healthy bodies are more protected from corona and more protected from the bad course or the severe disease that can happen with corona. So water is a good thing.
I guess finally, Doc, I was just looking at my time and where the sun is when The elder said he has bleach. I just want to put in my first order. It's after Sabbath already. I need 2 gallons. The other thing is, if your body immune system is what fights off disease, I guess you're advocating that we should seek at all costs to strengthen our immune system.
Definitely.
All right, and that would mean taking in vitamin C through fruits and vegetables and a salt. All right, I imagine you saying that. I'm also thinking that since exercising is also a part of the strengthening of your immune system, then we should start seeking to mushroom exercise clubs all around the place, and that the church should pay particular attention. Also, I can imagine that the sunshine is also another area of focus and concentration, so we should be careful about going on the beach. And I guess also those of us who have the tendency of over-exhausting ourselves and not taking sufficient rest, then we should go back there. And then, of course, we'd want to be able to be temperate with all things and be careful about how we use what we have. One final thing I'd like to say, I am perturbed about where information is coming from. And with social media, the tendency is to receive all kinds of information coming from all kinds of places, and you don't know where they're coming from. Just a few days ago, I received a forwarded piece of information that says coronavirus is not going to affect black people because of the genetic structure of black people's blood and that kind of thing. You know, to me, those kinds of things are propaganda because they don't come with certain kind of credibility in terms of who is sending the information. So my question would be, here in St. Lucia, what is your guide or what is your take on that? Who are the persons that are what organization is responsible outside of, I think, the government via the Ministry of Health? Are there any other established communication points that we can call credible so that when information like that comes to us, then we know exactly that this is credible information and that we need to look at it? Because I find a lot of what has been said creates a lot of doubt, creates a lot of perplexity and uncertainty, and that can dislodge the attempts that you're talking about here in terms of how we provide leadership and guidance. And so one other thing, because you did indicate that this special group of people in the community that can respond, first responders, I am thinking as a recommendation that maybe what we can do is in the individual committee, because with the traffic and all of that we have, the question that is raised is how long responders are going to take to search out these persons. So I'm thinking that maybe we can identify responsible persons within the context of the environment, and we probably need to measure them and mark them out, that from this point to this point, this is the individual responsible, equip them with the necessary communication tools so that they could feed back information and train them with the skills so that they'll be able to verify what is a flu and what is COVID and that kind of thing, so that, you know, the information can be more accurate. And maybe one other thing I'll say, if you see me coming into church with a bottle of Bounty rum, it's not drink I come to drink. It's my hand fluid I'm going to be making, all right?
It's going to be 160 proof.
Yeah, 160, that's good?
That's good. 160 proof.
All right. So I won't be drinking, Elder.
Overproof.
And those who are tempted to buy, make sure you are buying for the purpose of coronavirus.
I'm glad about everything you said there. In particular, two very important points. Your immune system health is very important. Now, you have to be careful about how you exercise in groups, because that might turn into a mass gathering. However, you must exercise. So even if in fact, I would almost urge you to exercise on your own, but make sure you exercise, or exercise in a small group. Okay? Gymnasiums, going to the gym with 100 other people, not so sure. Not so sure. But definitely, you mentioned your church, small groups, individuals, you know, yes. Exercise for sure. Rest for sure. Proper diet for sure. reduce stress. Stress affects your immune system. So we must find ways to reduce stress, even as we face this epidemic. And I kind of alluded to that, how we must support each other. People must feel financially secure, food secure, emotionally secure, if we are going to tackle the epidemic properly. So I fully take on board all of that you said there. The other one I think is really very, very, very important. And I think the ministry should take note of that. Back to the military strategy. That idea of having people in charge of areas and that they are well armed with information, they have the communication tools, and they have the surveillance in place to make sure that they have that area under control. So anybody who gets sick in that area, they're on that case, making sure the right people are called, making sure the right things happen. That is brilliant, because that's what we need to do. Right? So all of that I think is, well, and if you have that structure that we mentioned about the command centers going all the way up to the top, so that we can mobilize all the necessary resources to respond even at the level of a household, based on the call of one of the people that you have that is in charge, or that the community has in charge already. Very good. Very good idea. Yeah?
Okay, so we'll be wrapping up. We need to be temperate in all things. And so we've been here for quite a while. Louise, our colleague from Trinidad, said hi. She's watching online.
She's online. Hey, Louise, what's up?
Okay, so a few other questions. The question about garlic. Well, whether garlic helps to fight coronavirus. There's another question about sexual intercourse, if it can get transmitted through sexual intercourse. And there was a statement to go over how to make up the bleach. Okay. One of our listeners online wants to know how to make up the bleach. And what else? Well, yes, lemons and limes. And I think there was a question on disposing of the mask. Doc, you spoke about putting it in a covered bin, but suggesting, well, asking if we could put it in a bag and tie the bag. What other measures can we put in place for the mask?
All good questions. So now don't go too far, because you have to remind me of all of them. So, what was the first one?
The garlic.
Garlic. Garlic is a good substance. Garlic is part of our food. Garlic is not magic, though. Garlic will not cure your coronavirus, but garlic will help you to be more healthy. It will help your immune system. It will help your cardiovascular health. It will help a number of things. So garlic is something that I fully support. I think people should use garlic, but I don't want you to think that garlic is going to cure corona, okay? It's in the same lines as our vitamin C, our fruits, our and so on, okay? Now, what's the other one?
Well, let's go to
sex. Of course, you can get coronavirus in sex, because in sex, you are less than 3 feet away from somebody. I don't know anybody's having sex and they're more than 3 feet apart, right? You're sharing. Now, it's not the genital fluids that are the problem, but you're going to be sharing oral fluids. Right? Your hands are going to be all over the place. So, yes, sex is a risky factor. So don't have sex with people who have coughs and so on. Right? Important. Next?
Lemons, the use of lemons.
Oh, lemon.
Limes.
Well, that's our vitamin C.
Yeah.
That's right there. Lemon, lime, grapefruit, orange, cherry, all these things. Yeah, it's good.
And, well, there was a new question I think is worth asking. Do animals get coronavirus? And I'm thinking maybe pets and so on around us.
They actually advise you to be careful how you handle the animals, because although I do not know about dogs and cats, but the public health thing is do not, if you handle animals, make sure and wash your hands. Hand washing when you handle animals is very, very important. Actually, there was another one, which is the making up of the bleach.
Yeah.
So the thing is, it depends on the percentage bleach that you have. If it's 1% bleach, then it is a 1 in 10 dilution, which is 1 cup of bleach to 9 cups of water. Okay? If you prefer, whatever one measure you have to 9 measures. Okay? So it could be 1 tablespoon to 9 tablespoons. It's just a 1 of bleach, 9 of the water. That's for if you have 1% bleach that you're using. If you have 5% bleach that you're using, which is often marketed as concentrated bleach, then it is a 1 in 50, which is 1 cup to 49 cups. That is 1 measure to 49 measures. 1 measure of bleach to 49 measures of water. So a lot depends on what bleach you're using. Now, some bleach bottles, because I was looking at one the other day, it doesn't say what the percentage is. However, it tells you if you want to decontaminate surfaces, use a 1/4 cup in a gallon. I saw that on one bottle. Now, clearly, I do not know what the percentage is, but if they're saying that, I believe that the 1/4 cup in the gallon must be creating the 0.1% solution. I'm assuming that the bleach manufacturer knows what the concentration is and has worked it out. So some bleach bottles actually tell you on the back, but what you're looking for is the volume required to decontaminate surfaces. Yeah? That's it? Yeah.
Good night, doctor. My question is, how do you protect your airways?
How do you protect your airways?
Your airways, yes.
Well, it depends.
I came in late, so I wasn't aware of if you made a statement on it.
I did, but I'll summarize for you. It's good for all of us. I said this is a droplet spread disease, primarily. So in a casual situation, once you are 3 feet or more away from people, you are unlikely to get it into your airway. Okay? Because the droplets tend to be heavy and they tend to drop within 3 feet. If you are in close proximity, to somebody, we are saying 6 feet, because you do get some aerosols when you in prolonged proximity. That is, you're there with somebody, living with somebody who has the virus, or you are a healthcare worker, 6 feet. And if you are in that situation, so if you are in a situation where you are going to be in a casual one-off contact, you're going to be within 3 feet, or you're having prolonged contact within 6 feet, you then should be wearing a mask. That is when you should be wearing a mask. When you are caring for somebody with known coronavirus and you're going to be within 6 feet of the person, then you need your mask. Okay? How we protect generally workers in various places is we were saying that when somebody has a cough, we put a mask on them. Because when we put a mask on the people with the cough, the droplets don't project out. So then that means although you're within 6 or 3 feet of that person, they now have a mask on them, so your airway is now protected. The other thing, there are certain special situations with healthcare workers where they are manipulating the airway in sick people, or they are nebulizing the person. That is, they are pumping like substances into the airway, and they make aerosols. So these are very small particles. What we are saying then is these workers must have what we call the N95 mask, which is a very specialized mask, or no, it's a specialized mask that has a better filter than the ordinary surgical mask. So it protects you from what we call airborne, small viral particles. But in casual situations, in the general public, it's larger droplets where the surgical mask protects. Well people do not wear the mask. It is sick or coughing people that wear the mask. The other thing I should say, I didn't mention it, but let me say it now. cough etiquette. The other thing you can do if you don't have a mask, okay? Because many people don't have a mask. What you must do is you cough into your arm like that, okay? And you put your head down. So you want to cough, go like that. So you're coughing down to the ground into your arm. So it doesn't spread out to everybody, okay? The other thing you can do, and you mentioned toilet paper. The other thing you can do, if you have tissue, you can, same thing, bend your head down, cough into the tissue, put the tissue into the bin, and wash your hands. Okay? So that, I think that's important. I didn't mention that, so I wanted to put that down. You mentioned toilet paper. I hope I answered your question, Chief. Toilet paper. Why is there a run on toilet paper? I have no idea. I think Mia Motley said toilet paper, so Mia Motley, the boss, everybody buying toilet paper. Why would you need toilet paper? Okay, maybe for coughing. Now, diarrhea. This virus does affect your gastrointestinal tract, your intestines. It does infect them, which is why the virus is found in your stool, just like it's found in your urine, because it can infect your renal tubular cells. But diarrhea is not a common symptom. They say just under 10% of people with COVID-19 will have a diarrhea. So it is not the common symptom, okay? But it can happen. So I guess the other thing about toilet paper might be to wipe down surfaces. However, for me, what I think is better is the more heavy-duty towels, right, rather than toilet paper. The hand towels. Yeah.
Dr. King, I would like to find out what can you do to protect yourself if you're working in AC, because remember, we don't breathe fresh air in an AC system.
Now, ACs are something else. Now, you see, ACs would spread aerosol infection, not droplet. So, chances are, in a regular, normal AC, we are not going to spread coronavirus in the room if somebody has it, right? Unless it's a small room with an AC and somebody with coronavirus is in there coughing a lot. That might be the only time when it might get into that circulation in that room. But if that is happening, if somebody is coughing, they should really have that mask on their face, so we should be reducing that spread. So primarily, the message I want you to go home with is this is mainly droplet spread, and it is only aerosolized and airborne in certain special circumstances, when airways are being manipulated or when people are coughing a lot in an enclosed space. So generally speaking, in most places with AC, the virus will not be spread in the AC. That is at least my understanding of the disease at this point in time. Sure. There you go.
Brethren, we would love to stay and continue, but then it's already late, so we're going to take one more question and one more question from the congregation, and then we have one more online question, after which we would have to stop regretfully.
Good evening.
Good evening.
What if you've had pneumonia to the point where you were hospitalized? Does that put you at a greater risk of getting complications if you get the coronavirus and also an enlarged adenoid? Does these two things? What? Adenoids. Enlarged adenoids? Adenoids?
Oh, adenoids. Yeah. Sorry, I hear you. I got you. I understand. Okay. Well, if you have, when you say pneumonia, you mean a pneumonia from something else apart from coronavirus?
Yes. My son, he has been hospitalized because of pneumonia in the past. So I'm a bit concerned if he were to get pneumonia, corona, can the complications be greater?
Only if he has chronic lung disease which if he had an acute pneumonia, is unlikely he has chronic, but does he have a chronic lung condition?
Well, he has, I would say, mild case of asthma.
Asthma.
Yeah.
So asthma does put him at a higher risk of having complications if he gets the coronavirus. So I think he should be, you should try for him not to get infected, but he has a couple of things going for him. He's young. So, and as we were saying, that this virus tends not to be as severe in young people, but his asthma would give him a greater risk of having a more severe cause. Adenoids, not necessarily. The thing about the adenoids is they tend to give you upper airway obstruction, so you might have a lot of snoring and that kind of stuff. But in terms of corona, I don't think the adenoids are going to put him at greater risk. But the asthma is something that you have to think about.
One more quick question. What are some of the superfoods we can eat to really boost our immune system?
But look who you're asking that question to, eh? There are many foods that people talk about, right? I am no expert on nutrition, that I'll tell you. So I'll just tell you my simple approach is plants are the greatest superfoods that I know of. So fruits and vegetables and all those various types of plants I think we should be using. There are herbs that we can be using, and many of them, I see them in the plant category as well. No problem with any of them, right? You are more of an expert than me on our local herbal concoctions that we would use, but there's nothing wrong with using those. I would not use them to treat corona, but I would definitely use our herbs and our vegetables and our fruits and our other foods that we have available to us. I would definitely use them as part of our diet to keep our bodies healthy.
Okay, an online question. The social space and the using of masks. So at the banks, we cannot adhere to the rule of the social space.
The 3 feet.
The 3 feet. Do you think that we should, as customers, clients who are well but cannot adhere to the 3 feet rule, wear masks to protect ourselves?
Well, I can tell you what we are doing in our business, which is anybody coming in who has a cough gets a mask and gets their hands and has to have hands sanitized. So the best thing you can do is to isolate the droplets that come out of somebody who coughs in them. Now, you're talking about the talking, the droplets from talking, as we mentioned about earlier. That's a little bit more difficult. Now, I have tried to tell my staff that as far as possible, put your chair back, right? Do what we call engineering, ordinary engineering, so that the customer is 3 feet away from you. The other thing that we are looking at, and you can look at too, is you can have these Perspex shields. Now, banks, I seem to remember some banks or some banks before you actually have a Perspex up and you do your transaction under. I've also that's all of these are possible that you can look at. How do you create barriers, or how do you make the space? Now, should you be wearing a mask? I would never tell you don't do it, but I'm just telling you it can be more dangerous because, as we said earlier, you tend to, when you have a mask on, you tend to be fidgeting with it a lot. The person who you are less than 3 feet from, the droplets are all in front of you. You've put your hand there, you're moving up to touch the mask, you are infecting your mask from the very same person that you're trying to protect yourself from by putting the mask on. So I would prefer that you put a barrier, a clear barrier, or you put yourself at 3 feet and you have your hand sanitizer. That I think is better. And of course, you put the mask on the coughing person. Why can't every teller in a bank, for instance, have a set of surgical masks right there? And if the person is coughing, give it to them. And you say you cannot be more than 3 feet away. You sure you can't be more than 3 feet away? A teller. It's difficult, eh? You know? So maybe the best solution for them is to try and have put on the shields. When I say not on them, at the front, you know. So each person, guys, you're gonna have to look at your own business place and see. By the way, this is good for everything apart from just Corona. You know, Corona is only. I was telling a doctor the other day who was really kind of freaking out about the Corona and stuff. I said, you know, but you have all these people with coughs and colds and everything, so all these viruses every year coming through your office. You're not worried. H1N1, all kind of bad flus passing. You ain't worried. Corona is coming, it's waking us up, right? Because, you know, next year, there may be another one that might be 10 times worse. Because remember, the original SARS had a 10% fatality. MERS had a 35 to 40% mortality, you know. It didn't affect a lot of people because it was not that infectious and didn't spread as far. Can you imagine if we had a virus like MERS that was spreading like how the SARS COVID-19 is spreading, and 40% of people were dying when they got it? That would be effectively almost like a Holocaust for the human race. But wake-up call. It might yet come. So maybe this is the first message for us as the things we need to be putting in place. And let us not stop the measures that we're putting in place as we move forward. Because this might be the first warning of things worse yet to come. So maybe it's a good thing it's this kind of virus and not a worse one. Yeah? That's it? Okay. All right. So I should tell, hey, Lucy, are you watching? Nice to have you.
On behalf of the administration and membership of the Zion Seventh-day Adventist Church, together with attending community stakeholders to this presentation, I would like to extend sincere thanks to you, Dr. Stephen King. We appreciate the wealth of knowledge that you have taken the time out of your busy schedule to share with us. People generally tend to be deathly afraid of things that we do not understand. The emergence of this COVID-19 is no different. As prophesied in the book of Luke, surely our hearts had almost failed for fear. However, your informed presentation has gone a long way in calming much of our anxieties, and in empowering us to place ourselves in the most viable position to manage what would become a desperate situation. More than this, we find comfort in the realization that your expert council actually corroborates age and all principles of health and well-being already highlighted in the Holy Scriptures and championed by this church. Again, I say thank you.